So what I want to begin to question them, and in a curious way, like I always do, is have you noticed that oftentimes you get this feeling like these things, like these brilliant interventions are coming from me and not from you. Like this has nothing to do with you. And slowly, Lisa, what we could do then is get into how they give me all the power and then what it's like to give me all the power. Because if you're giving all the power and idealizing somebody, that leaves you in guess what? Position in a devalued position with no power because you've given it all away. So yes, I have to work with that. And that's the counter transference. But I want to say just one other thing quickly. There is something else that are called enactments, which are often used in the literature synonymously with counter transference. But an enactment is when you actually get pulled into something with somebody and you start acting or really believing like you have all the answers and that you really are rescuing this
Well,
person. Yeah, go ahead.
that's part of the shared fantasy, wouldn't it be? But not in a romantic way, in
Yeah.
a different type of a way. They're trying to pull you into this, right?
Yes, exactly. That's the shared fantasy that you and I again have discussed at great length. We have anyone watching could go back and check that out. But it creates an illusion that it's the two of you together in this blissful, magical relationship. Yes. And that's a very dangerous place to be. So that's an enactment where you actually start playing in, sometimes unknowingly, at least initially. And what you have to do then in terms of how you handle it is once you recognize it, which you should, because you're always reflecting and doing these things on your own as a responsible person or a therapist, then you have to gradually work your way out of it, but you use it nevertheless. It's all what we call grist for the mill. What happened here? You want to understand it then with the patient, and that goes back to what I mentioned just a moment ago, is then to begin talking to them about how they need to see you in this way. And sometimes I may even fall into it, and you have to let them know, don't try to be deceptive, because letting them know that you made a mistake, that's therapeutic as well, because now you become more human to them and you let them, you sort of model that it's okay to make mistakes.